One of the things I learned in my journey as a physical therapist is that there's always things that we can do to improve people's lives. My name is Bernadette Gillick, and I am a neuroscientist and a physical therapist. And I combine both of those roles in working with children who have early injury to their brain and resultant cerebral palsy. Our research specifically combines non-invasive brain stimulation to understand how a brain is functioning, especially early on, and how it is recovering from an early injury throughout the lifespan. So we use neuroimaging, we use non-invasive brain stimulation to understand how a brain is functioning, and then trying to influence through our interventions combining rehabilitation with non-invasive brain stimulation as an intervention or a treatment to look at how could we potentially augment or improve the lives further beyond what we're currently doing in rehabilitation in pediatrics.
I did my undergrad here at Madison in neurobiology, and I really loved the program and the city, and so this is my top choice for PT school. The three main things that drew me to this program specifically were the strong neuro track that it had, the opportunity to participate in research, and then also the unique event that they have every year called Go Baby Go.
I was really excited about the potential of working directly with students and having those students work in our research laboratory, learning how to translate what they're learning in the classroom to how they can translate that to the clinic, actually being able to work with families and work with the children.
I personally think I have one of the best jobs in the Pediatric Neuromodulation laboratory. I'm a baby monitor, so I monitor the babies when they go into the MRI machine. I look at their vitals, make sure they're doing okay. And then I also provide a lot of education to the families about what we're doing, why we're doing it, and what it can mean for the families in future. I think what I enjoy the most about being part of the research team is working with the families. When you think about it, they're coming from a very vulnerable place. Their child usually just had a diagnosis or just had a really traumatic medical condition happen to them. So the fact that they're able to come to us very selflessly and participate in this research, it's really eye-opening, and it kind of makes me realize and remember why I decided to go into physical therapy in the first place.
You could not make a better choice than to come to the University of Wisconsin-Madison and become a physical therapy student. We have incredibly devoted faculty who care about the human spirit, both the students and all of the patients and people who we serve. And then in terms of all of the research that we do here, we combine this in the department to actually allow students all of these different ways to combine an understanding of the evidence behind what we do in the clinics and beyond with what we're doing with research here at the university. Again, we have so many resources, and we're so excited about the potential of working with students.